if you can get up and clean off the seat for our next guest. He is a world-renowned physician, a graduate of the University of Michigan, though we won't hold that against him. Cardiologist with SLU Care and SSM Health SLU Hospital. Good morning, Dr. Michael Lim. How are you?
Good morning. Great.
Ooh, I like your bow tie.
Thank you.
Very sharp.
Let me fix your microphone here.
I know.
Very
it was that way
sharp.
last week,
Why
too?
doesn't Jimmy Holder take care of the microphone?
He's
That's outrageous.
just so messy, Jimmy
It's
Holder.
all that hot
We got,
air.
we got it all fixed here.
All that hot air coming out of his mouth. It fell right down. All right, let's talk about Dr. Michael Lim. Jimmy, would you mind? We're on the air here. All right, doctor, you've had some really good tips over the last couple of weeks. Now there is a study about not taking your medicine. What's going on here?
So I don't think this is fake news, although it's published in the New York Times.
Right. Okay.
They put forward really, I think, a very important concept that we don't think about very much. I think, society and the folks and your listeners, we sort of have a dichotomy of how we think. When we're really sick, we're really sick. We want help, and we'd like to figure out what's wrong and try to get better. But even if it's, let's say, strep throat, which is running around a little bit, just got a text from a family member saying that they probably have it. It tends to be that if we're prescribed antibiotics for 10 days, we take them for 7.
Right.
And then we have another 3 doses or 3 days left of antibiotics we never take. But even more importantly, there's a lot of diseases and a lot of conditions that are chronic, are lifelong. High blood pressure is a chronic condition. Diabetes is a chronic condition. Many conditions. Asthma can be really bad. COPD, or chronic obstructive pulmonary disease. These conditions don't have cures. These conditions can be maintained and stabilized with daily treatment. It means that an individual person has the opportunity, if they take a medication or a group of medications on a daily basis, to be able to keep that disease at bay. And in many situations, it really works. This article points out the fact that we're terrible at it. Taking medications every day, we're absolutely terrible at it. And so what we do is we end up riding the roller coaster. So the body's pretty tough, and the body can deal with a lot of stuff, and you don't necessarily pay the price the first 2, 3, 4 days that you don't take a medication. But down the road you do. And so then you have major exacerbations of what's going on. So high blood pressure can creep up on you and become really high, can shut down your kidneys, can cause you to go into heart failure. You need to be in the hospital. Sometimes you need to be in the intensive care unit. You got 4-day hospitalization with 2 days in the intensive care unit, and you're costing a lot of money.
All because you just didn't want to take the pills.
Well, but we're a society, we're a minimalist society from that standpoint. It's not necessarily that they on purpose said, well, I'll take the risk of going in the hospital. And so, well, I feel great.
Right.
I think you guys do the same thing. I do the same thing.
Right.
I feel great. Why do I need to take this medicine? I feel great. And so we're caught in between of, we know that we take the medication on a daily basis. We probably do prevent a lot of hospitalizations. We probably do prevent a lot of badness and cost in medicine. But certainly taking them on a daily basis kind of admits the fact that we got these things that are just there every day. And we love to believe we're well and we're healthy. And that's the crux of this.
Is it all just that I feel fine, I don't want to take it today? Or is it because these people don't have the money for the prescriptions, and so we don't have the money for the pills, but we have the money to then hospitalize them?
Absolutely. Great point. I think in something this big, the absolute answer of truth is, well, it's both. It's both. I remember specifically a certain time, this is a few years ago now, where I saw a patient in the hospital who had been hospitalized multiple times over the past several weeks with high blood pressure. And finally I went in and said, this is the first time I was seeing him, and I said, hey, this can't be fun for you. And he says, it's not. And I said, if we get you on the right medications and you stay on them, we can keep that blood pressure under control. And he says, I know, doc. I said, well, tell me how I can help you do that. And he says, I can't afford them. I said, okay. So Schnucks, Walgreens, a whole bunch of places have $4 or $5 prescription plans right now. I told them, if I can give you 3 medications that are going to cost you $12 every 90 days, can you afford that? He says, absolutely. Hadn't been to the hospital since. So there's ways to do this.
Right.
It gets in and taps into a little bit what we were talking about last week in terms of, the financial piece is one of the most uncomfortable things that patients want to bring up. Nobody wants to admit, hey, man, I can't afford this,
Right.
or I don't have it. This is a point of pride, and people want to just take their prescription, and I'll figure out a way. And then when they get that prescription and they figure out how much it is, like, look, I don't have a way. I got to either eat or take this medicine. So that's a bad deal. I would encourage.
But it's also, I'm sorry, it's also costing society. Because the $12 every 90 days works. Him going to the hospital 6 times in a month is costing everybody.
Well, I can't tell you that all of medicine works very hard to find those $12 for 3 medicines.
Right.
Sometimes, in general, we don't work as hard on that. Sometimes we prescribe medications that cost more than maybe they should and don't work at that. But we do have that opportunity. So a patient should take that on and say, and work toward that. So well, how can I get into an affordable range here?
Yeah.
At the same time, the patient needs to understand diseases like that are chronic and need to be treated lifelong and will contribute to a longer life.
One more thing. You mentioned antibiotics, and you mentioned a 10-day supply. Every doctor's told me take the full 10 days because you can do more harm by only taking it for 3 or 4 or 5 days.
Absolutely. So, the vast majority of folks only take it for a short period of time because then they start feeling better and they stop taking it. Oh, I'm done with that infection. The problem is that you're not completely done with the infection, and what you've done in only taking a shorter duration of antibiotics is you have now pre-selected the bacteria that are more resistant, and you've punted the can down the road for a much bigger problem in the future.
Yeah.
So if we give you a 10-day supply of antibiotics, it kind of means 10 days.
There's a
14
reason for
days
that.
means 14 days. Keep taking it.
We had 6 kids in our family. I don't know about you guys, but my mother would hoard the medicine. Oh, Linda took this 6 months ago. You take it now. This worked for her.
Yeah,
Yeah,
absolutely.
it's one of those deals.
And that's there's nothing fundamentally wrong with that in terms of intentions. I think the concept behind what we're talking about this morning is not that anybody has bad intentions.
Right.
I don't think doctors have bad intentions. I really don't think people have bad intentions on doing this. I think they're trying to do the best they can, and they're trying to be highly practical. Well, if I only need it for 5 days, well, I can keep this other 5 days. Maybe I'll need it down the road. Highly practical concept, but fact of the matter is, and that's the main point of this morning, it just doesn't work.
Yeah. Dr. Michael Lim, good stuff. Cardiologist
Yes.
with SLU Care and SSM SLU Hospital. Thanks for coming in.
Thanks, guys.
Thank you.
828.